What we'll be showing you today is the application of two very similar products. One is called a Nylon ankle brace. This is for after a patient had a sprain. It comes in a box like this, or if they have any swelling from surgery. A lot of times after we take the stitches out and the patient removes their surgical bandage, we'll give them one of these to maintain that low level of swelling they have when they wake up in the morning. You can see it's actually a sock type device, a little hole at the tips so the toes would be exposed. So what you do when you apply these guys, you're basically sliding this up the foot. It is very tight, okay? A lot of times what you can do is kind of roll it. You can see if this is the heel of it, and here's the toe where my left hand is. You can actually roll it down a bit to help it get on a little easier. Very frequently we're putting this on a very painful foot. You have to be careful. Patients are going to be uncomfortable. They may have incisions. You want to keep that in mind when you're applying this. So I kind of turn it inside out to just the heel portion is showing, and we're going to slide it over the foot just like this. Now he may, the size of this one, this is it's a large. It should fit him, but you can see how tight this little guy is. It's not easy to get on. But once you get there, you can grab the upper portion and just pull it up the foot. And he could probably go a size larger to see how tight he is. But in the interest of time, we're just going to apply this one here. You can see, here's the heel portion. We make sure that falls exactly where his heel is. I'll try to pull too many of his leg hairs out. And you can just tell if this patient had just had surgery, this wouldn't be the most comfortable. Now this one unfortunately is not the appropriate size for his foot, but there we go. So you can see how that, you can see that in the film. You can see how that heel portion matches his heel. You're going to bring this up the leg so it's nice and even and it's laying nice and flat. Some patients are going to have very large calf muscles. If that's bothering them, there's two ways you can treat that. The easiest way is just while they're here in their office, I would just fold it down just a little bit so it's not quite so tight for them. All right, make sure it's nice and flat. If that continues to bother them, I would advise them at that point what they can do is take a small scissor at home, all right, and while it's off their foot, cut the back portion here, just a little tiny V, just a few centimeters long. What that does, it allows it to open up at the top so it's not so uncomfortable. As far as the foot, you want to make sure that these little guys, the toes are still exposed, all right. You don't want to smash them together, especially because we're putting these on patients after surgery. So if they've had a bunion surgery and you're not keeping it at this level and you pull it up to this point on their toes, what it can actually do is pull that bunion back to where it was before, or a hammer toe over here. So make sure that this is falling just behind the toes, and you try to smooth that out so there's no wrinkles. In this case, I think he could definitely use a larger one, so I would go to the next size. But it would be easier to apply that. So that is the application of the nylon ankle brace. Now some patients, sorry if I get your hair here. Good. All right. Some patients come to our office and they have extreme pain in the backs of their heels. There's actually a spur that's created, and he actually has this mild bump there as well. And that's from where the attachment of the Achilles tendon is. And when people have that, sometimes the backs of shoes are going to irritate that area on their foot. Now when you dispense this, there's a little picture there that shows you how to apply this. The patient, you can definitely give that to them so they can see that when they go home. So you can see how that little pad goes underneath the foot, okay? And it does have a different appearance on the top as opposed to the bottom. If you can see that, it looks like a little Pac-Man ghost. You have a round top and a more curved bottom. So I would make sure that that curved bottom goes on the bottom of the foot. You can actually see it better here. And that round portion goes up the leg behind this Achilles tendon. So in this case, you can see on the inside there's a nice little gel padding. That's what gives them that relief. You want to make sure that it's protecting the area that they're having their discomfort. So you'll be able to feel the back. You can ask the patient how it feels. And you want to make sure that gel's covering just that spot, and that's how you apply that one. And that is the Achilles gel sleeve.